Hello, Dr. Hizon, here to talk about documenting for a patient with depression. As a disclaimer, please refer to your particular doctor. This is a general course not intended to be of medical treatment, and your particular situation may vary. So, symptoms of depression, it's a mood disorder that causes a persistent feeling of sadness and loss of interest. There can be angry outbursts, irritability, and or frustration, even over very small matters. There's a loss of interest, there could be sleep disturbances, and feelings of worthlessness or guilt, fixated on past failures or self-blame. On the physical exam, mainly to evaluate for neurologic underlying medical conditions, and also we'll do a medical status exam, and we may use some questionnaires like the PHQ-9 test. On the testing, we'll do a history, we'll do a physical, there's labs if medically indicated, and we may do advanced imaging of the brain, such as X-ray, CT, or MRI. Treatments can involve medications. It can be involving consultations and referrals. Typically, there's lifestyle modifications. There may be various medications we use for depression. SSRIs stands for a selective serotonin reuptake inhibitors, and these are some of the ones you might see, Celexa or Zoloft. There's non-selective ones. There's atypical antidepressants like Wellbutrin. And then there's just a bunch of other different kinds of medications that could be used. The treatments and therapies can be psychosocial, psychotherapy treatments, or cognitive behavioral treatments. And on patient education, as a reminder to get plenty of sleep, stay active, eat well, and try to do stress management. There may be medications used, treatments are prescribed, and then follow up with your primary care, medical provider, or specialist. So on the documentation for a patient with depression, it would start with a chief complaint, and it could be a such and such year-old male or female complains of feeling down or depressed for how many days, and you could add in some of the other chronic conditions. You would go through, again, what the date of onset is, the context, if there is anything that set it off. Do they have a past medical history, social history, or family history of mental health disorders or depression? And are their symptoms different if they're at rest? How many number out of 10 at rest, and how much with activity? Does it prevent or interfere with their daily activities? And do they have these sort of feelings of hopelessness, helplessness, loss of interest in daily activities, appetite or weight change, sleep changes? Is it constant or intermittent? Are they associated symptoms like loneliness or isolation, marital or relationship problems, recent stressful life, chronic illness or pain? And provocation, what makes it worse? Or alleviation, what makes it better? Are there associated symptoms such as sleep changes? Do they have recent stressors? Do they have any symptoms of numbness, pounding in their chest, mood or behavioral changes? And in the past medical history, have they had head injuries or medications or surgery? Have they had trauma such as a traumatic brain injury or concussion? What have they done so far to treat it? What medications and therapies? And have they had a previous workup? Physical exam, labs, referral, and have they seen any specialists such as a neurologist or psychiatrist? In the past medical family social history, we'll go through, do they have a family history of depression or mental health disorders? Are they a tobacco user? And how's their exercise program, their nutrition plan, and their current sleep habits? And constitutional symptoms on review of symptoms, have they gained or lost any weight since the last visit? And then you go through the rest of the review of systems. On the objective findings, focus mainly on a general, are they mild, moderate, or severe distress? And then after, usually the focus will be on the neurologic and psychiatric aspects of the physical exam, and that may be their speech, thought process. Do they have SI, which is suicide ideations or homicidal ideations? Do they have psychotic symptoms? Do they have attention or concentration problems? Mood or affect? Mood would be depression. Affect would be flat or labile. And do they have good judgment or do they have poor insight? And on the assessment of the medical decision making, you want to know, is this a simple situation or a complicated case? Does it require straightforward or complex decision making? And then this is a chance for the provider and physician to give a rationale and reason for the treatment that they have picked. On the ICD-10 codes, F32.8 is other depressive episodes. F32.89 is other specific depressive episodes, and this is a specified one, versus a Z code, which is usually a preventative code for screening for depression. That'd be a Z13.31. Plan and treatment: you can use medications. There may be therapies as prescribed, specialty consultation, as well as primary care follow-up or specialty follow-up. Some pearls or pitfalls: if there is any laterality, left or right, things that are affected that needs to be documented, be sure to document all symptoms and duration, past medical history of chronic illnesses, trauma, losses, past medical health disorders. Do they have a family history of neurologic mental health disorders? Learn the various questions and physical exam tests to be performed, as well as the neurologic exam. And then ask your doctor or provider if you have any questions about the documentation necessary for the evaluation of a patient with depression. And in primary care, ask about quality measures, such as have they had a colonoscopy in the last 10 years or a mammogram in the last couple of years. And takeaway points for the patient with depression: it's usually severe enough to cause noticeable problems in the day-to-day activities. This needs to be documented. You want to look at the treatment that requires the patient's cooperation and compliance. The diagnosis depends on detailed documentation of the symptoms and accurate history of the present illness. It is important for the provider to rule out any differential diagnosis, other illnesses, or condition. So as a medical informatics specialist, study hard to learn the various questions to ask, such as what we would talk about in the questionnaire. The PHQ-9 is a common depression questionnaire that is used. Learn required mental health, other questionnaires that provided that will assist the provider in documenting for the patient. And again, while we at doctors may save lives, medical informatics specialists and scribes save doctors. Thank you.